Hey, what's up, everyone? Thank you for being with us. We really appreciate your time. We know that these are super hectic, really busy, really stressful times. And we're really grateful that you chose to come and spend this hour with us. My name is Isabella Restrepo. Y'all can call me Bella. My pronouns are she, they. And I'm going to do a little professional introduction and then I'll do a personal introduction. So, professionally, I'm a researcher. I'm a doctoral candidate at UCSB, which is really just a fun way of saying that I'm a researcher. I look at the way that criminalization works in California. So I study the ways that criminalization, incarceration, and mental health services come together to create experiences of incarceration and discipline for racialized communities. The project that I'm working on right now looks at the way that Latina girls in California are criminalized by the foster care system. But more generally, my work really looks at the way that criminalization moves through all of these different helping services, many of which we are all parts of. So that's a little bit about me professionally. Personally, I am a queer daughter of immigrants. I am really passionate about this work because I grew up in a household with beautiful, amazing parents and a beautiful family that had a lot of mental health issues that went unaddressed. And for me, in my family, what that translated into was addiction. So this work really speaks to my passion and my interest, but it also speaks to my personal experience because I understand what it means to live in a household with untreated mental health issues and symptoms, and to not have the resources that you need in order to be able to really deal with them. So that's a little bit about me. I'm really excited to be in conversation with y'all, and I hope that we get to learn and have fun together. And with that, I will pass it down to Ali.
Thank you so much, Bella. And good morning, everyone. So happy to be here with you all. So allow me to introduce myself. Ali Guajardo, my pronouns are he, him. I'm a licensed clinical social worker practicing out here in Santa Barbara County. I have over 7 years of official clinical work as a social worker, graduating in 2015 from Rutgers in New Jersey. Since graduation, I have been in the Santa Barbara County area. So in that, I have had over 6 years of doing crisis response work with programs such as Wraparound for Santa Barbara County, which is, taking the most youth that are at risk of being placed in a higher level of care, whether that's residential or juvenile facilities, and to really keep them in home and keep families together. So in that work, I was on call every day, 24/7, with like 2 weekends off. So that's kind of where the crisis work started. Slowly worked my way up to become the supervisor of that program, overseeing, over 25 staff who were doing wraparound work, as well as supervising the safety program, which is Santa Barbara County's crisis response team mobile unit. So I was a backup clinical supervisor for that, supporting those on the front line that were responding to crisis, and also worked with commercially and sexually exploited children with the Department of Behavioral Wellness here at the county. So in that work as well, lots of crisis response, having to go into hospitals to conduct assessments with the youth. And currently, right now, I've been in this position for the last 10 months. I'm the behavioral health provider here at the Santa Barbara Neighborhood Clinics. We're a community clinic, and I provide consultation and therapy to patients of the clinic, specializing in trauma as well as LGBT behavioral health. My work that I do is, the passion that I have is really rooted in social justice, but as well as it's very much influenced by the work or my lived experience. So as I said, my pronouns are he, him. I identify as a trans man. And I too come from a family of addicts and addiction where mental health was untreated. I kind of got to see the benefits of my mom finally getting treatment in her late 40s. And so that was just kind of inspirational there. But I've also been placed in foster care between the ages of 12 to 18. So I aged out of foster care as well. So I'll be using a lot of my personal, insight and experiences, just as much as my clinical work, to kind of guide us through these trainings and overall just make our communities better. So I'm excited to be here in community with you all. So let's go ahead and set up the learning community. Next slide. There we go.
Thank you. So this is an 8-part series, and these sessions will build on themselves. In this session specifically, we're going to be really building our learning community, but this 8-part series in general will focus on crisis response and intervention. That's really based in care and that centers justice diversion, right? Our ultimate goal is to ensure that people who are experiencing mental health crisis don't get funneled into systems of criminalization. And really with this series, I believe that the slides are uploaded or emailed to you. Ande, could you confirm?
Yes, they received them after, and we have recordings as well.
Perfect. Thank you, Ande. Our ultimate goal, though, with this series is to ensure that y'all walk away with tools and insights on how we can support marginalized people who are experiencing mental health related crises without furthering their involvement with the criminal justice system or without causing even more harm. And here are a couple of things that you can expect to learn throughout this entire series, so this 8-part series. We'll talk about how you can minimize harm during crisis. In the work that we do, we have all seen, unfortunately, right, that in one way or another, the ways that people experiencing mental health crises can be further harmed by us and can also cause harm to us or to the other people around them. Or the people trying to support them. And so we'll discuss how to minimize this mutual harm through a trauma-informed lens.
All right, in the third session, we're going to be taking a look at brain functioning for someone who is in crisis. It's super important for us to understand how the brain is operating and what are some interventions we can do to help alleviate stress and the ultimate, fight, flight, freeze response for someone in crisis. So yes, we'll be learning basically how to assess the brain function so that we know the best intervention to de-escalate any crisis and reduce emotional dysregulation.
We'll also be talking about how to conduct a trauma-informed assessment that's based in crisis, that is through an intersectional lens. And really what this means is that we're gonna learn how to assess while considering the overlapping needs of queer communities of color. So we're gonna be considering race, class, ability, and all of the different kind of intersecting privileges and oppressions that the communities we work with navigate.
And in addition to that, we're also I'm going to be teaching you some dialectic behavioral interventions, as well as eye movement desensitization reprocessing interventions that will basically give you tools that you can use during active crisis situations. Like I said, overall, the goal there, really helping one emotionally regulate and desensitizing them to the emotion reactivity that we have in crisis. One thing I forgot to mention in my introduction is that I'm also trained in dialectic behavioral therapy, been doing that for the last 3 years, and eye movement desensitization reprocessing, which I've been doing for the last 5 years. And working here at the clinic, I often get someone who is with a doctor expressing suicidal ideation who's coming in to seek help. And I've been able to implement these interventions on the spot. And not once have I had to take that one step of now I need to call safety or law enforcement just by implementing some of these interventions. So I'm excited to share these with you. I think they're really, really helpful.
Yeah, and I just want to add to that. I think that Ali really downplays his capabilities. His track record is stellar. When Ali, he's been doing crisis work for a really long time. He's never once had to call law enforcement to intervene. We are going to talk about how that happens, what are the tools that he's been using, what are the direct, tangible things that we can do while somebody is struggling with the mental health crisis. And in addition to that, we're going to learn how to conduct proactive safety plans. And really what that means is safety planning that considers the positionality of the person that's in crisis. This includes identifying their community-based supports, assessing best practices for the individual that we're working with, because it's going to be different for every individual, and developing a plan that proactively responds to their unique crisis, so that the goal is that the people that we're working with never go into an acute crisis where police need to be called, because we'll have a proactive safety plan that diverts us from getting there in the first place.
And lastly, specifically for this session today, just to kind of prep you all and kind of get you prepared, we'll get to know each other. Some of you have already started dropping name, kind of what agency you're with and what role you play in the chat. So we'll kind of continue that. We will have you all do a brief little, what we're going to call a needs assessment, but it's really just giving us an understanding of where you all are at and what you all are needing so that you guys can get the most out of this training and really maximize the learning opportunities here. We'll also work together collaboratively to develop community guidelines and boundaries. Just because in doing this work, it's tough. We're in vulnerable positions here. We're all in a place of learning and unlearning. So I want to make sure that this is the most safest space we can have so that we maximize participation. And then we'll also, lastly, be looking at the ways that COVID has impacted the work we do, as well as the communities that we work with. So on that, we're really looking to hear from you all. I see some of you from, homeless shelters, therapists. So really, really looking forward to getting your guys' insight on what you guys are seeing.
Thank you. Next slide, please. So we want to take a little bit of time to get to know y'all. The work that y'all do is so important and is extremely exhausting. And I want to start by acknowledging that. It's incredibly valuable and necessary work that often causes a lot of burnout. And so throughout this series, and especially in the needs assessment, we hope that you will be as thorough and as honest as possible, because we want to make sure that these sessions are helpful to you, whatever it is that you may need in terms of crisis response. So let's get to know you a little bit. The first thing that I'm going to ask y'all to do is to please add your pronouns into your name. And the reason that I like to start with this is because as somebody who's cisgender, as somebody who moves through the world with the privilege of being cis, we have to proactively think of ways that we can show allyship to people that are navigating the world without that privilege. And putting our pronouns into a meeting, like a Zoom meeting, for example, is one of the quickest, easiest, most direct ways that we can establish allyship. And it also, if there's a trans person in the room and they're the only one that has their pronouns up, it outs them, right? So if the rest of the room already had their pronouns up, it wouldn't require that the trans person outs themselves by being the only one that has their pronouns. So I'm sure that by this point, we're all super familiar with Zoom, but if you're not, you just hover over your picture, click the 3 dots that are in the upper right-hand corner, click rename. For me, it's at the bottom. I believe it should be at the bottom for you. And then add your pronouns into your name, please.
So once you've done that, I'll ask for you guys to, if you haven't done so already, to go ahead and put your name, the agency you're with, the role you play in that agency. There's maybe a few words or sentences on why you do this work. Again, giving us the opportunity to really get to know you and see, who we have in the room today.
Yeah, so
in addition, sorry, Bella. And in addition to what Bella was saying about the pronouns, in doing this work on Zoom through a time of COVID, it's the most visible thing we can see that allows for inclusivity and kind of sends that message of I'm safe, right? But it also helps us normalize the need to ask for pronouns, or just normalizing pronouns in general, and helping us deconstruct the binary, right? We look at a screen and we see someone with a beard or we see someone with makeup, and our brain is automatically going to go to, oh, they must identify as male or female, she, her, he, him. And so this kind of helps us break away from that as well.
Yep. So the 2 things you're doing right now is adding your pronouns into your name. And then in the chat, if you haven't already done so, yes, there you go. Drop your name, what your role is, and yeah, why you do this work. Program coordinator for youth life skills program at Tarzana Treatment Center. Hey, the Valley, I'm from the Valley. I have always loved working with it. Underserved youth and plan on getting my MSW starting this fall and becoming an LCSW to continue work. That's amazing. That's such important work, especially in a place like the Valley, right? Whenever I watch TV shows, people are always kind of making jokes about the Valley because it's such an underserved community and it's a largely racialized community. So this is really beautiful work and I appreciate you for doing it.
All right, let's see. We got mentoring programs.
Okay.
Residential treatment centers.
Triage shelter, that's hard
Youth
work.
life skills program. Youth empowerment project. Oh, nice.
Okay, this is dope. So this is nice because we have a good collection of folks that are coming from different areas of mental health work. This means that we will be able to have robust conversations. for the
Mhm.
Youth Acceptance Project. That's amazing. That's beautiful. And I really appreciate programs whose job is to kind of stabilize the home, right? We know that being entered into foster care is a form of trauma in and of itself. So, Vida, that's really
Global
beautiful.
crisis team. Oh, we got folks out of Boyle Heights, East Los Angeles. Ooh, that's my origins. All right, we got people from like Sacramento to East LA, Orange County. This is great.
This is beautiful.
All right, Bella, should we get going on that
Let's
needs
do it.
assessment there? I want to make sure we have enough time.
I'm going to save this chat, by the way, so that I can go through this and read about y'all. So keep
Counselors,
dropping them if you
college
haven't
students.
already. But while y'all are doing that, we're going to move on to the needs assessment. So if you can move us on to the next slide, thank you so much. So this will take us about maybe 10 minutes. It's just a couple of questions that will help us assess what kind of support y'all need in terms of crisis response. As y'all can see, everybody is coming from different, very, very different arenas. This doesn't mean that there is an overlap, right? So this crisis assessment will help us figure out how to make this most useful to y'all. So if you can click the link that I just dropped in the chat. And let me just confirm, y'all, let me know if anybody is having trouble accessing it.
And I think it'll even take less than 10 minutes. I think that needs assessments, few questions, so it might take maybe 5 minutes.
Yeah, this won't be very long. All right.
See, we have a lot of like passionate folks in here, a lot of passion for the work we do.
Mark, that's a lot of work to do. And I find right now, right, case management is such difficult work right now because so many of the people that we're working with, we can therapy somebody until the end of days, but if what they're struggling with is something like basic needs, this work becomes incredibly difficult. Anna, that is such a good point, right? Whenever we're coming into any situation really, but especially crisis situation that is so anxiety inducing, that triggers our own responses of fight, flight, freeze, or fawn, it's so important for us to be aware of ourselves and the traumas that we're bringing into the space. Alrighty, folks, I'm going to be quiet for a little bit. You know I talk a lot, but I'll be quiet so that y'all can answer these questions and we will come back to you in about 5 minutes.
Okay, private practice, outreach coordinator, Imperial Valley. Just seeing these responses in the chat has me even like more pumped on giving this training than I even anticipated.
Right, I agree.
I'm like gonna cry a little bit. Here at the clinic, I'm often working by myself as a behavioral health provider. I think the doctors and nurses, they're great. And I think there's this component where they tend to miss like the work I do and like, just how taxing it can be on self, right? Because I'm coming into this work very vulnerable and open and honest. And I don't have that, like, I guess I'm not jaded yet from this work. So just to hear some of you all kind of share why you do this work, it's giving me fire right now. We do such important work.
And FYI, y'all, while y'all are filling out these questions, I know that it's difficult for people doing in this line of work to get every Wednesday of this cohort series off for an hour to be able to come to these sessions. we would like to invite you to join all of the sessions, because all of these sessions are going to be building on themselves, building on each other, and ultimately helping us build a toolkit for crisis response. I know it may not be possible for everybody, but I just really want to encourage y'all to come back, especially because being in community with people several times will help us get more comfortable with folks to participate, and to really kind of fully give ourselves to learning.
So while they're still filling out that needs assessment, maybe they're already done. Shall we kind of just carry on verbally here?
I think we should give folks another minute. We have 7 that have been submitted. So I'm assuming that
Okay.
people are still working on them a lot. So let's give folks another minute.
Thank you, Bella. So we got one here too, who's also operating from sounds like some personal experience that brings you into this work. Welcome.
All right, Ali, you want to move us on and I'll look at the needs assessment.
All right, so thank you all for taking the time to answer those questions. I know some of you are still working on them, and that's okay. Again, we just want to make sure we are getting your guys' needs so that you get the most out of this training. But currently in the state of where we're at, we're still navigating a global pandemic. And, in my work, and I'm sure in the work you all are doing, it's become very clear, right? That Brown, Indigenous, people of color, people that identify under the LGBT umbrella, as well as other communities that are, like Bella said, lack of resources. It's very clear that we don't have the resources or the institutional support that we need to help individuals not only just survive, get by day to day, but thrive, to have fulfilling lives. And these hardships really pose a threat to multiple areas of their lives, their mental health. Again, we'll talk a little bit about that, and just overall the social development. So I guess, we can go on to the next slide, please. Actually, I jumped the gun there. But yeah, I guess we'll leave this slide here, but I would like to open up the discussion a little bit. So feel free to unmute yourselves, as I just want to ask you, in the work you all are doing, again, various different roles. I know you all are seeing what I'm seeing. So thought I'd ask, what are some of the impacts you all are seeing during the last 2 years of COVID? Has it impacted your work? Has it impacted resources in the community, staff, personal life experiences? We're seeing more burnout. How have the populations you serve changed? Are we seeing more crisis? So if anyone's open to sharing just some observations of what they've seen on the impact of COVID for the communities you work with.
I'll share. I, from both serving our clients and just myself, just mentally exhausted. With our services, once COVID hit, we actually opened up 7 days a week to ensure our home, because I work for a homeless veteran agency, to ensure our homeless veterans get to shelter, have access to shelter at all times, that staff are checking on them consistently, checking for any symptoms. So it has just been a total burnout. I mean, mentally, physically, and just constantly trying to extend yourself. So kind of just running on empty and on fumes at this point. We're finally getting stable, but it's mentally, it's been exhausting
Yeah,
and
Vanessa.
emotionally.
Yeah, Vanessa, thank you for sharing. And you are so right. Again, we are all surviving this pandemic. We have our own families, friends, loved ones that have been impacted. The fear that we've experienced, the fact that we work in work where we are needed, we cannot afford to take the time off, right? Ideally, we could, but because of our passion and our drive, we've come into this work knowing that we're here to serve people that are in need of help. And right now, the need is overwhelming. So if you're feeling burnt out, exhausted, I want to say I'm right there with you, right? Self-care has become this thing that just gets it's very intentional when I have to do it, but again, it's just harder and harder when you come back home and you're just like, wow, what a day. I'm drained. And you mentioned kind of working in with houseless folks, getting them set up with shelters, and at least here in Santa Barbara, that is the number one thing I'm seeing is there are no homeless shelters. There's no homeless shelters and none for LGBT here in Santa Barbara County. So thank you for sharing that. Anybody else want to share what they're seeing, what they're experiencing during this time of COVID?
Sure. So I also serve a veteran population, but I specifically work with LGBTQ plus veterans in North Texas. We're seeing a big loss of community. People aren't able to meet with one another. They're not able to be in the same physical space with other folks. And it's taken a real psychological toll. There's just not that support anymore. And of course, the psychological toll plays into the medical issues that they come back with because they're just under so much stress. And then the resources for folks who need assistance in the community have dried up. You lose your job, I have nothing for you. People just don't see COVID as a big issue anymore. But for folks who have any sort of immunocompromised with themselves or their family or disability, any sort of resources that were there are just gone. They're just not there anymore. But COVID is still here. People are still being affected.
Yeah.
So yeah, it's tough to serve people without having those resources even be available. And that's been a big source of burnout over here.
So again, you're also hitting on some of Vanessa shared, right? Like just community resources. There's a lack of support in those areas. You're also talking about that feeling of loneliness, disconnect, loss of community. And this is for your veteran population, right? So it's like interesting to know that it's also occurring there. I just had a youth come in last week and he was, suicidal. And so I'm exploring why. And he's like, as a trans man, he's 21, but he's like, I don't have any friends. Like he basically has been isolated for the 2 years of COVID. And there's one agency here in Santa Barbara called the Pacific Pride Foundation that offers like community events and like groups, and they are not even doing in person. They have still not done anything in person. So he was kind of just like, I have nobody, I'm alone. Like, why aren't the resources that are here, like understanding that as like queer people, we need community. We don't have friends and family that are accepting. So he was kind of hitting on that too, that feeling of loneliness. At another youth, another trans male, we spent one session where he was talking about how lonely he's been. And he, at the end of it, just kind of says, like, it's been 7 months since I've been hugged by somebody. And then he like cried for the rest of the session. And I just sat there with him kind of being like, wow, like, again, I'm so privileged. I have people around me and I'm not even seeing how just something as simple as like having a hug by somebody is needed. So it's definitely, we can see across the board, right? I'm sure many of you are seeing this, but an increase in depression, like disconnect, isolation, living in households where we're rejected or we don't have the resources, those things are going to increase the depressive symptoms one might feel. And then ultimately, the worst case of depression, right, is that there begins to be that suicidal ideation or that hopelessness that then leads them into a crisis where we're now coming in to intervene. And when it's like, wow, you're going to be facing homelessness and there's no resources, it can leave us feeling depleted. So helping them find hope in a time where hope is really hard to see is definitely, you know, like Vanessa said, taking a toll on us as well, our spirits, the work we do. So thank you, Courtney, for sharing that experience, that lack of resources and loneliness. How about
Meg, I
anyone-
can, oh, sorry, go ahead.
No, go ahead, Bella.
I was just gonna say, Meg writes in the chat that they haven't been able to get into the juvenile hall. Kids are really isolated with limited support. I mean, if we're feeling isolated, if the folks that are on the outside are feeling isolated, I can only imagine how much worse it is for youth who already have such limited autonomy if they're criminalized, and who now don't have access to their mental health workers. And for some, I know in Santa Barbara County, there was a really long period of time where families weren't able to go in to visit their youth either. So thinking about how this isolation is compounded by things like criminalization.
Yeah. You know, at least when you're out, you have access to your phone. You know, if you were quarantined or needing to lock down, at least you had your phone where you can access your social media or call a friend. But when you're in the institution and you're in juvenile hall, that's another, it's like a social death almost.
Yeah. Does anybody else have anything that they want to share in relation to how COVID has been impacting their work or the crisis they're seeing, or even themselves, before we move on to a quick overview of the needs assessment?
Hi,
I
this
can
is
share also.
Go ahead.
Go for it, Rosa.
hi, this is Rosa Diaz from the Imperial Valley LGBT Resource Center in Imperial County.
Ooh,
And
okay. Welcome.
thank you. We've had pros and cons with COVID. Some of the cons, of course, have been that we've had to do a lot of stuff virtually. But it's been the youth from the center who actually have requested for us to be able to meet again face to face. And that was very helpful, very encouraging. As a matter of fact, because of that push, we began to open up all of our groups, of course, following protocols, but it was good. And I think also that a lot of times it is the messaging that could either cause people to fear or to feel more comfortable. And one of the things that we encourage people at the center is, one, there is a lot of messaging, and then we do have to follow the CDC and public health guidelines. And by doing that, it's a good rule of thumb that if there is mask mandates, we push mask mandates. If there is no mask mandate, we don't push it. But at the same time, we also say, look, whether you believe that everyone should be wearing a mask or you don't, that's not a debate that we're going to have at the center. You can come to the center wearing a mask and you're welcome. You can come to the center not wearing a mask and you're welcome. We will follow the guidelines, but at the same time, we want you to, if we call this a safe place, we want it to be a safe place. So all of our groups are being done in-house and virtually. People have options, and that has really helped us to gather up the groups again. That would be including the 4 domestic violence groups that we have a week, plus the transgender support groups, etc. And you know, it's working for us. But I think, because I've been in other meetings with CEOs and leaders from other LGBT centers, and they say if they don't show a vaccine pass, if they don't show a COVID negative test, if they're not wearing masks, they can't come in. And again, I think that could be, could work against you. But people want community. People want to come together. People want to see facial expressions. And I think that if we have a guide, it's good to follow it. But the messaging should be this, as far as I'm concerned, and what's been helping us is that we follow the guidelines, but we make it comfortable for everybody to make their decisions. If the
Mhm.
guidelines, you follow them, but it's,
Yeah.
it's up to you, because it is your health and it is your values. But above all, if we are too strict, we're pushing people away, and that brings about that fear and loneliness.
Yeah, and I think that you're really pointing to something that a lot of centers are struggling with, right? Which is the balance between providing in-person services to support the community around them and also meeting the needs of the people that work there, right? Because if somebody is, um, immunocompromised and they're working at the center, I definitely see how that would be a really scary situation. So it sounds like y'all are doing a really beautiful job of figuring out that balance.
Yeah.
Thank you so much for sharing. So I want to quickly give us a little overview of the needs assessment that y'all shared. So I just looked at it really quickly to pull out some recurring themes. And it looks like y'all are all really looking for similar sources of support. The most mentioned need was more trainings or skills to de-escalate situations. So y'all are looking for more immediate tips in terms of how to de-escalate an active crisis situation. And a couple of people also put things that they can share with parents to help parents de-escalate crisis situations.
Oh,
That
okay.
is, yeah, that's
It's
first
right
of
up
all,
my alley.
absolutely, yeah, totally understand why y'all would need that. I think that when we have these conversations, they're often really abstract and we don't walk away with tangible tools. Throughout the series, y'all will learn a whole bunch of different tangible tools, not today because today is the foundational session, but we will be having, like Ali said, DBT, EMDR based skills and interventions that y'all can use in the moment. But part of that is also about learning brain function, right? And understanding what brain function is activated when the person is in crisis. So we'll also be having a conversation about that. Other things that came up are resources. I hear you. So many of the people that we're working with right now, the crisis situations are exacerbated or are even triggered by a lack of basic needs, right? People are losing their housing. People don't have jobs that are going to be able to support them and their families. And it's really difficult work when you're trying to stabilize a crisis, but the issue is basic needs. So we'll talk a little bit about how we as mental health providers can help navigate that, which, I know is really difficult. And with counties not having resources, I hear you, it's really hard. Also, a couple of people said not causing more harm. I really appreciate this because I think that we all go into this work with, our hearts are in the right place, but so often because we are part of systems that are based in, historical forms of privilege and oppression, it becomes really difficult to not cause more harm when we are navigating or responding to a crisis situation. That's going to be one of the central tenets throughout this entire series is how do we know, right, that these systems are inherently harmful to a lot of people, especially if they're racialized. So how do we as mental health workers who love the communities that we're working with, how do we minimize that harm in the crisis situations that we're part of? And then in terms of the kinds of crisis that y'all are seeing, suicidal ideation and self-harm, I definitely can attest to this increasing over the past 2 years. With COVID, we have seen so many crisis situations in our community that have been handled in really difficult ways. We just had a trans youth that was killed during a mental health crisis about an hour north of us. So this is definitely something that we're seeing across the board. I'm also seeing some people needing support with supporting CSEC youth. So looking at the exploitation of children and how we can support kids that are dealing with that. All right, so there are a lot of overlaps in the needs assessment, which is really exciting. And this is gonna help us really tailor the rest of the series to what y'all need.
Yeah. Again, we'll dive into that, those findings in our next session too, because that's gonna kind of build off of that. But all right, so for the last couple of minutes, we definitely want to set the foundation for our learning community, right? So I don't know if any of you are familiar with Brene Brown, but anytime I do this work, I'm like, channel Brene Brown. So she has this amazing book called Dare to Lead. And in that book, she discusses, just what's needed to be a leader and to spark change. And so I just want to read a quote from the book that kind of sets the stage here. She says, a leader is anyone who takes responsibility for recognizing the potential in people and ideas, has the courage to develop that potential, When we dare to lead, we don't pretend to have the right answers. We stay curious and ask the right questions. We don't see power as an infinite and hoard it. We know that power becomes infinite when we share it with others. We don't avoid difficult conversations and situations. We lean into that vulnerability when it's necessary to do good work, right? So overall, what I'm saying here is that we need to get vulnerable with one another in order to be our best selves and, lead the people we work with, lead ourselves, and lead the people like the patients we're working with. So we need to be able to have like uncomfortable conversations. We need to be able to give feedback, have conversations where we're not tiptoeing, be able to make mistakes without punishment or without anybody thinking less of us, just as well as like the ability to speak freely and seek support. So I know some things that I think we need to make that happen. Number one being a psychological safety place. A psychological safety is key here, right? So what do we need to feel comfortable and safe in this setting?
So a couple of the things that I have learned I need in order to be able to learn in the best way possible is I need a judgment-free zone. I need to be able to ask questions that may be silly to other people. I need to be able to answer, to give responses where maybe I'm making a mistake, and have the people that I'm in the space with let me know that I'm making a mistake without judgment. One of the key things I think is assuming positive intent, but also taking responsibility for our impact. So I know that we're all here out of, because we're passionate and because we want to learn how to do better in the work that we're doing and how to support the communities we're working with. Sometimes we're going to make mistakes. We're going to say things that maybe are harmful or that are offensive to somebody else. This is a place where we don't want you to not engage out of fear of that, right? So if that does happen, we will hold each other accountable with love, without judgment. And we will ask folks to take accountability for the impact that their words did have. And then we ask everybody to be okay with discomfort. We're going to be talking about a lot of things that are new information or that may be really uncomfortable to think about as mental health workers. And so we're going to ask you all to please welcome the discomfort. And we also want to learn what y'all need. Judgment-free zone, yes. We're going to make mistakes. We all make them. And it can be really difficult, right? When we judge ourselves or when other people judge us. So we're going to ask folks, when your teammates or when your colleagues are making a mistake, when they answer something in a way that we don't agree with, let's have judgment-free conversations. Active listening, yeah, stay engaged. I know it's really hard with all of the work that we all have. So we're gonna ask y'all to stay engaged throughout the session. I know it's easy to just kind of mute your camera and do something else, but we ask you to be present with us.
Feel free to use the reactions too. I know that's affirming for me when I give presentations in this work. So that can be used for part of that active listening, kind of going, I hear you, and I'm going to give you a heart. So feel free to use those. Space to participate.
Come on, and I see that you are struggling to, that there's no plus for yours. So the plus would be inside of a little pink circle on the bottom right-hand side. Does yours not have that? Okay, well, if you want, you can just message the stuff to me and I can upload it. It's anonymous, so they won't know that it's from you.
We're, seeing some other responses here for kindness, compassion, right? I like that kind of understanding that we all come from different walks of life, different educational backgrounds, experiences. And I hope that you all feel comfortable enough to share your personal experiences too. It's not just the clinical work that guides our work. It's those real life human moments that we've had ourselves.
Yeah.
Give space for dialogue and conversation, right? And I want to say that, I appreciate everyone putting things into this chat, but if you do feel like offended or uncomfortable with something someone said and you're not comfortable enough to share that in the group or whatnot, feel free to email me and Bella on the side if that's ever something, and her and I can brainstorm creative ways to address that concern, because again, we want this to be a space where we all feel judge-free, where kindness is being used and compassion, offering support to one another.
Yeah, and I want to point to space to participate in the way that feels comfortable for me. I know that, so I want to emphasize that we appreciate when folks have their cameras on, but we understand that that may not be possible for everyone, or you may not be able to unmute yourself. So we really encourage you to do exactly that, to participate in ways that feel comfortable to you. If that means the chat over unmuting yourself, or if that means that you're reacting with the emojis, that's totally fine. Grace, I definitely see that as connected to assuming positive intent. I want to emphasize that we all make mistakes. Ali and I have made them. And we're going to continue making them because we're human, right? And part of what learning, especially in this kind of setting, requires is that we develop that learning community and the trust within the learning community so that we can make those mistakes and then we can receive the correction.
And I want to say, right, I've been doing this work for 6 years, so there's still so much more that I can learn. I know some of you have way more experience in the field, like Juan mentioned, you know, he has his own personal experience. So feel free to like teach me some things too. Again, we're all equals in this room, just sharing knowledge.
Yeah, and I also want to emphasize that, you know, I think when we get into these spaces, it can be really easy to feel like, you know, if we don't have the experience or if we don't do the specific kind of work, we may not know, but we value experiential knowledge just as much as we value education and professional knowledge. I am sure that many of y'all have experiences with things like mental illness in your families, maybe, or in the people that you love and your friends. And that you have experiences that can really speak to the things that we'll be talking about. So we encourage you to pull from both your professional experience, your education, and your personal experience.
And thank you, Bella. Thank you, Ali, for everything that you have brought, not just today. This is years and years of professional and lived experience, and your passion definitely shines through. Thank you so much.